right, everyone. Thank you so much for joining us for the last session of our summit. Thrilled to have everybody here. My name is Jillian Saperstein. I am the Director of Fundraising and Special Events. I am a staff member of the Greater New York Chapter, and it's been a true pleasure to see everybody throughout the past 3 days give us their wealth of knowledge and information and resources, and just really share with everyone what it is that we have available here at the Greater New York Chapter, but also all of the services that we're able to connect you to and all of the advice we're able to bring in from experts in the field, in addition to what we have right here in our office. Speaking of having people right here in our office, I'm with a great number of colleagues. I have some really fantastic people here with me today. We have a little bit of everybody, which is kind of the point of the last session. We have Tracy Sandy Ali, Kyle Mohammed, Chris Dunn, Cherise Santos, and Michelle McKenzie. So we've got our equipment loan program represented. We have a nurse, a social worker, our intake coordinator who manages as well our transportation program, and Tracy, who is our Chief Care Services Officer. So we've really covered the full gamut here because you've heard this session promoted and talked about in every session you've gone to for the past 3 days. And so what's the point? Why did we ask everyone to come gather here at 3:45 on Friday? Because this was a lot. It was a lot of information. It was a lot of detail. It was a lot of different topics. And we wanted to make sure that you had a chance to come together and ask any questions that you had about any session, about anything across the past 3 days. That's why we've got a little bit of everybody here. And if we can't answer your question in this moment, we'll find the right answer for you and get back to you. So that's really what we're here for, just to help wrap things up and figure out what comes next and how we can best help you. So before we jump in, we've already got one question, which is great. And then a nice comment from Paul, who was one of our speakers this morning, who said, thank you to all of us for all the behind the scenes work putting this 3-day summit together. He learned some new things and is looking forward to the next one. And we hope that that is, to speak for everyone, we hope that that's a feeling that pervades the entire community for everybody that's joined us. So thank you, Paul. And does anyone have anything they want to share before we jump into our first question?
I'd just like to thank everybody for coming. It's been a great three days. And, I hope you learned a lot. And the more knowledge we can spread for ALS, the better. Thank you.
All right. Okay, our first question, thanks, Cherise. Our first question is about insurance. So our asker says, from my perspective, this is a bit of a long one, so everybody stick with me. I'm going to start again. From my perspective, healthcare and insurance creates categories: inpatient, outpatient, and home care. Are there any efforts in the industry to acknowledge that the outpatient care, like that provided by the ALS clinic through telemedicine, is consistent with home care? If not, what must be done to initiate change? I'm not sure who the right person to direct that to is, so if anybody wants to grab that, please feel free.
Well, hi, this is Michelle. I'm a social worker that covers the 5 boroughs. I often tackle a lot of insurance questions, but I'm not sure exactly understand the question. Are we doing something consistent with home care? Previously, before COVID, a lot of telemedicine visits were not covered by insurance, right? So the silver lining during COVID is that we've been able to do telemedicine visits and get them covered through insurance. It's a great question if this is going to continue long term. I really don't know the answer to that. And if not, what must be done to initiate change? There definitely needs to be a lot of changes in regards to insurance companies. I'm not going to lie, it's not patient driven. It is definitely cost driven. And there's a lot of things that we run up against because of that, which is one reason why we have the loan closet, that we offer equipment that you either can't get through insurance or they won't provide another one because you've already received one, or it hasn't been 5 years, so you can't get something even if it's broken. So there are certain things that we do at the chapter to try to get around what's currently not working in the insurance industry, but there's a lot of things that are not working. And definitely there needs to be more changes that occur, that things are more patient driven than cost driven. So
I'll just jump in on the end. Thank you, Michelle, for that. And Ron, thank you for your question. Michelle, great answer. And there's a little bit of ambiguity in the question, but I think that your answer was right on, Michelle. I'll just add that recently, the CMS, which is the agency, the government agency that oversees some of the rulings for Medicare and Medicaid and the billing, has recently come out with some expanded coverage and directly related to your question, which covers telemedicine visits. And I believe that that's a direct result of the COVID-19 public health emergency. So I think that's where it relates to an acknowledgement that some of the telehealth and telemedicine changes that we saw, that came to be because of the pandemic, there is a linkage between it, home care and these telehealth visits taking place in the home. So I don't know if that helps you at all, but I do want to point that out. It's right now it's a temporary expansion of coverage by CMS. So I just wanted to clarify that. We don't know that it will be ongoing. For right now, it is through the public health emergency, which again has not been declared by the the current White House administration as being over. We know we're still in it. So for right now, that expanded coverage does exist. Last part of your question, I just jump in and say to add on to what Michelle said, what's being done to initiate change. I'll talk about it from our perspective and from employees of the ALS Association. We are constantly advocating on behalf of patients living with ALS, people living with ALS. And so that's where the change really starts and ends for us, the constant advocacy. We're going to continue to do that. We're going to make sure that, we are the voice of not only the organization, but first and foremost, the patients to get things moving and enact change. So I hope that helps, Ron.
Great, thanks to both of you. All right, we have a question about if these sessions were recorded and will we be able to access them? Yes, absolutely. Everything was recorded. We are going to be putting them back online. They'll be available here on Whova, and then we'll also be able to host them after this session, if the summit officially closes down this webpage. We'll be holding on to them. They're great resources for us to have in the future. It is not instantaneous, though. It's not going to happen right now. It does take a little bit for all of those video files and audio files to get processed, downloaded, and back up here. So we are going to get it up. The presentations will be up here, and we will let you know when they are, but it won't happen over this weekend, which is this question in particular. Okay, moving on to the next question. All right, we live in a 2-story walk-up. We need disabled housing and are constantly thwarted from reaching that goal. Any ideas?
hi, so I know the person who asked the question. Hi, it's Michelle. I know that we've spoken about this issue before. Housing is a difficult topic in New York City. Getting disabled housing and getting affordable housing has always been an issue. Definitely look who's in your household, and maybe it's better for one person to go primary on an application than another, because I know who asked the question. That's definitely an important factor in their situation. So sometimes it does make a difference if the disabled person is listed first. Sometimes it makes a difference if the most elderly person is listed first on an application. If you have some financial concerns also, please reach out to me if you're in the New York City area, or your regional team to discuss ways to fill out applications for affordable disabled housing. It's not a quick process. It does take time, and there are certain things that I can remind you about, certain websites, different things that happen to come up occasionally, open up wait lists for housing that have often been closed. So happy to discuss that with you. If you have any of those kind of specific questions that are really tailored to you, just shoot an email, phone call, text to your regional person, and we're happy to set up a Zoom call, FaceTime call to really address it, because that's not a quick thing. It's definitely a more complicated issue and needs to sometimes be tailored to the person specifically.
Thanks, Michelle. All right, there's a question about advocacy. Paul, I want to let you know I'm working on getting an answer on that offline. I'm not ignoring your question. I'm trying to get a robust answer, and we'll circle back on that one. All right, another question that's come in is, seems like if we have home care dealing with wound care, that it should not preclude with the ALS clinic visits via telemedicine, but it does. It makes no sense to me. Thoughts?
Well, thought is if someone's going to the ALS clinic, then yes, they would hire a nurse to come to the house to do wound care. Wound care is specialized. So it's actually different from the clinic, and that would have to be through a home care agency, if that's the answer or if that's the question.
And this is a great question. And this is exactly what this session is for us to realize that this might be something that we need to follow up on this a little bit more and that we can connect with you offline. So I will make sure, so I'm the behind the scenes person on all of this technology. So I'll reach out to you and find out a little bit more details about where you are if you're not already known to us, and we will connect you with the right person in your region. And we'll get that all taken care of and make sure that you're getting a full answer to your questions where you guys have a chance to connect and there's not, this exact format there, and make sure you've got everything that you need. All right, so while that's maybe not a full answer on that one, we will follow up with you shortly. Okay. All right. Okay, that's all I've got so far in terms of questions. So please have those, continue to send those in. And let's take a stab at Paul's advocacy question. So we did announce that we have the asks for this year, which is 2021, and that is great. And we're wondering, what's the feasibility of asking for research funding to better understand the role of cannabis to help alleviate some of the discomfort that goes along with ALS, pain and anxiety? If I heard correctly, this is Paul saying there are no trials going on right now. So I checked in with Tiffany a little bit offline, and she said, you know what, it's a great question, and let's look into it more and let's find out. Let's talk to our national office. Let's find out what their plans are for our asks for advocacy for the coming year. And let's share this as a comment and a perspective that's come up from our community. So not a full answer, but that's what this is for. We're going to follow up and we're going to find out more and we're going to get you more details. Plus, we can't submit questions. We can't send people thoughts or needs from our community unless we know what people want. So this is a great forum to share this information with us, but also support group and meeting with your regional team and talking to everyone from the chapter is another great opportunity to do that. So to shift that over a little bit, for those of you who maybe weren't with us at the very beginning of the summit on the first day in the bright and early in the morning, I was wondering if we could look to Michelle and Charisse to talk us through a little bit of what a home visit looks like and tell us what it's like when the care services team from the chapter comes to your house, or these days comes to your computer.
All right. So I'll be happy to start that as the social worker and then hand it off to Charisse as the nurse. So a home visit pre-COVID would be that we would drive to your house and we would spend a good hour and a half in your living room, kitchen, bedroom, wherever, getting to know you, asking questions, just finding out more about what's going on, sort of taking a look at your environment, letting you get to know us and feel comfortable with us so that when there does have a question or problem arise, a face with a name and who to talk to. Same thing now these days. We still do home visits. They're just now virtual. So they're via Zoom or FaceTime. If the person doesn't want to do that, they feel self-conscious getting on the screen, we're always available via phone as well. But it's been really great actually doing the Zoom and FaceTime visits because I really do get to see you and know you. If you're new in this last year and I didn't see you before, I really get more of a sense that I got to know you after the hour and a half we spend online, as opposed to just talking on the phone. Plus this hurts after an hour and a half. So I really prefer to do it this way. So on a home visit, I would first and foremost just let you know who I am and how I can be of assistance. We talk about chapter services, things that the chapter will do that we can provide free equipment loan program, transportation to the clinics, support groups. Now with in this era with COVID, everything is virtual, so it makes it more accessible to attend any of our support groups online. And we've expanded those support groups, so they're during the daytime as well as in the evening. And then really an opportunity to find out where you are on your path of getting diagnosis and what problems we can specifically address with you, whether it be something as big as a housing issue, or it could be insurance related. You need more home care. How do I go about applying for a Social Security disability? You need access to maybe a food program. These are things that, as a social worker, I'm happy to assist you with. And then if there are more medical questions that come up during our visit, I would refer it to my RN, who's also my teammate for my region. And I think it's a perfect opportunity to let Charisse talk about what an RN does on her home visit. As her screen went off. Hi, your turn.
Charisse, you're muted. There you go.
Hi. So as Michelle said, in pre-COVID, we would go to someone's house and drive and see, what the necessary accommodations might be. If somebody needs a raised toilet seat, or what we would think for doorways or wheelchairs, and then we would send them off to Kyle and Ben, and then pass it along to them. Most of the times it comes from the clinic, but still, if we go to someone's house, we could see. Now we can see on video, and they bring their cameras to their bedroom, to their bathroom. We can see through their whole house and see what's happening. We could see if someone needs a specialized bed. Everything is different now when it's on video, but obviously we want to see people in person, but that will happen at some point. Medical reason, we could see, like, if somebody needs something that we have to pass along to the clinic, and then we are definitely the liaisons for that. And then if somebody needs something, we call the clinic, we get them assistance in between. Any kind of support they need. We have the social worker, like Michelle is. In New Jersey, we have Debbie. If they need help with Medicare, changing their job, getting on disability, Debbie would be there for that in New Jersey, just like Michelle is. And then Debbie also does the home visits. So we all work together.
Also, just one more thing. Hopefully, if we haven't already caught that you're a veteran in the beginning process, during the initial home visit, we definitely want to ask that question, because if you're a veteran, we want to make sure that you're connected to the Veterans Administration, because they provide a lot of services for ALS community. And that's a key thing that sometimes I learn upon the first home visit that we're doing. And we make that referral and then continue that sort of relationship. In addition, the home visits are just not a one-time thing. So, we follow up with you, we check in with you, and sometimes a big thing happens. And I just met with you maybe a month ago on home visit, but now's the time to apply for Medicaid, or now's the time to apply for Social Security disability, or you really need home care. We hop on a Zoom call and we really be able to talk about it in more specific terms, because those are not easy things. Those are big things to talk about, and you kind of have to hear it more than once sometimes to figure out what the next step is.
Yeah, and now I feel like we're doing it more often because of COVID. We're available a lot more than we could be in person every 3 months. So we're always available. We could do a FaceTime or, home visit like that anytime.
Great. Thank you both very much. All right, to go a little bit backwards in the other direction, And I just saw Chris turn right around because she saw that this one coming her way. So Michelle mentioned that if we didn't find out in the original, assessment that you're a veteran, that we would be able to, talk about that and learn that during your home visit. But that means that at some point, in order to have Michelle and Charisse and their colleagues come to your home, we have to know that you need us to be there. So how does that happen? Chris, I was hoping you could tell us a little bit through intake, what kind of questions are asked and how that works.
Yeah, I didn't leave.
Oh
I was
no,
here.
I saw you turn right back around. It was like your
Oh,
sensors
no, my
went up.
phone was buzzing. So yeah, so typically, if I get the initial call, I'll register the person and explain our services to them. And part of that service is getting the home visit. So based on where the person lives, I will go ahead and let them know that it'll either be, Michelle or Debbie or Charisse or Nancy or Helen, depending on the region they live in, that I will refer to them, ask them to give them a call to set up the home visit. So it's after the initial intake. They received the list of all the services we provide, and then the next step is the home visit, virtual home visit right now, which is a great thing because it's a nice next step. After hearing all the info, and I answer as many questions as I can, it's nice to know though that the next thing will be that they'll meet with a nurse and a social worker, either or both. So it's kind of like the next, the follow up to the initial call. And typically it's within a couple of days of the initial call.
Great, thank you. So another thing that was mentioned at the home visit is that you can have a bit of an assessment and see what you might be needing and see if something's coming up, for example, wheelchairs or communication devices. And I see Kyle seeing his sensors go up because he is one of the managers of our equipment loan program. So Kyle, I'd love to hear from you about how that works a little bit. And also, what do you do if you need something? Who do you call? Who do you talk to? Who do you email? How does this process work?
Okay, so I would like to just touch on the home visit part. I do think the home visits give us more information to work with. It helps us help you better. And when just to start with equipment, it can come from anyone. I feel if you talk to Charisse, Michelle, you can reach out directly to me. That's my preference, but that's how we would start that process. You can also have a conversation with your therapist, as I mentioned, but typically it's a regular conversation. How are you? And how are you feeling? And are you moving better today? And it's pretty simple. I don't want to overcomplicate it, but I will always say that you do need to follow up with your therapist because I can hand you a piece of equipment that is working well today and everything feels simple, but you may feel different in a day or two. So you just don't know how that is, but it is a streamlined process. You'll talk to Chris, you'll talk to our social worker, our RN. Our social worker will let you know what's available through your insurance. And if you have a glitch in that process, then that's when the equipment loan program steps in.
And what about if I have a piece of equipment that I'd like to donate? How does that work?
Well, yeah, you reach out to me and I'll figure out if it's allowed in the program. I mean, there's a lot of equipment available in the world in the DME section, and we can only handle certain things. What we want is the best for our people living with ALS, but you know, we it depends. I'm sorry. So there's just a lot out there.
Yeah, that's the answer though. It's that sometimes the answers are simple and sometimes they're complicated, but you're the guy to go to with questions about that.
And I just want to add something, if I can.
Please.
Is something that maybe we cannot take into the loan closet. We do try to find someone that needs the item and set it up directly from the donor to the receiver. And we've done that before. And that could be a piece of equipment or it could be some type of medical supplies. What else, Kyle? I'm trying to think. Stairlifts.
So the more specialized equipment that are too large for the closet, yes. So the indoor stair lifts or a more complex, higher end hospital bed, those are things that we do keep track of if we have an offer of that type. We would ask our social worker or even the ALS clinical staff if they know of anyone who can benefit from this. And then it's up to that individual family to go get it. But we do like to connect people with anything that we're aware is available.
Wonderful. Okay. All right. Still not a ton of questions coming in. I guess that means we did a really good job going over everything over the past couple of days. But if somebody has been with us since the afternoon on Wednesday and it's now heading towards the end of the day on Friday and is feeling a bit overwhelmed and maybe a little bit frozen about what to do next, what would we suggest that they do? What's their next step?
They can
Um,
call me if they'd like to.
Yeah, I think reaching out to Chris in the office or your regional team. If you have, I'm sure it's a lot of information. You're trying to digest it. Maybe you need a couple of days and you have some follow-up questions. Definitely reach out to your regional team, your social worker or nurse in your area, and they'll be happy to either answer your question or put you in connection with somebody who can.
Great. That's a pretty simple answer. Call us. We're happy to help you. We're happy to put you in touch with whoever you need to be connected to, whether that's one of us or not one of us. All right. So it's been 3 days of lots of information. I certainly have learned a lot. But first, I see that we have been joined by Sue Zimmerman. Hi, Sue. Welcome. Thanks for being here with us this afternoon.
My apologies for having my occasional technical difficulties
We have certainly
getting on.
some of
But
those.
I've been hearing you for like quite a few minutes and hearing the answers. And if there are any questions I can answer, I'm happy to.
Wonderful. Thank you. Yes, we've all been familiar with a few technical glitches over the past couple of days where no one is a stranger to them. So I was hoping you could
Especially
tell
me.
us. Well, we're here to help. And thanks to our meeting support, our friend Mike, who's been with us for many of these sessions behind the scenes, and who a lot of you have heard from. Sue, could you tell us a little bit about care management and what that is?
Definitely. Care management is a part of our patient services, of course, and it's for people who have more complicated circumstances um, beyond ALS or as a result of ALS, whether it's anxiety and depression and they need some help dealing with that, or there are some issues in the family that um, uh, some short-term counseling would be helpful, or they're having a lot of trouble dealing with getting home care because perhaps they're living alone and don't really have supports that can help them very much. So it's for any kind of situation where someone's circumstances are a little more complicated than they already are uh, to begin with, diagnosed with ALS. So it would be if there's a particular psychological problem, social problem, in addition to the adjustment to dealing with ALS.
And how would somebody be referred to care management? Do they call you directly, or if they're not sure, does the regional team help connect you? What's the process there?
Essentially, all of those. I can get referrals oftentimes directly. Someone may see my name online and see that they can call me for help with, say, a referral for a psychotherapist or a family therapist, or certainly the social worker on the multidisciplinary team can refer me through Chris as people call in through intake. So either people contact me on their own or referrals through my colleagues at the chapter or in the multidisciplinary teams, the ALS centers.
Wonderful. Thank you so much. All right, we've got a question sent in. This one's for Kyle. Why don't we have a ramp program? And can you recommend any organizations that can help me get one?
So why we don't have a ramp program, I don't think I'm the best person to answer that one, but we do offer portable ramps in the equipment loan program. Those are limited because they cannot accommodate, every type of entrance, of course. And companies, I mentioned the durable medical equipment companies that facilitate our loan closet services. They actually have departments that handle these type of things. So when you call me, I would definitely recommend you to them so they can do a free at-home consultation for something like that. Also, I think it's always best to mention that my colleague Ben, he was going to talk about this the other day, that he does the televisit to help determine what type of ramp you need. So that's how we help at the start. And of course, we will connect you to any company in your area that can complete the job.
Great,
I hope
thank
that
you.
answers.
Yeah, I think
There are also some resources for getting some financial assistance with ramps, with rebuilding an outdoor ramp or an indoor stair lift, things like that. I can't think of any right now off the top of my head, but there are some that will help financially.
great. And if
Well, I will just jump in on the end of that. Kyle, thank you for what a great answer, and Chris. But in terms of why we don't have one at the ALS Association Greater New York chapter, like many nonprofits and health organizations, there's limited funding to all the programs that we would love to have in place, but we just cannot. There are also some other logistical things in terms of having a ramp program, such as limitations on space and capacity in the loan closets that we have, and logistics around having the proper staff be able to, go out to the homes and be the right certified professionals to look at those modifications, and that also entails an expansion of staff that we just don't have at this time. But I do want to assure everyone that we definitely have resources for other organizations that can help, and as Chris mentioned, resources for organizations that also help with funding for ramps. So just wanted to add that.
Also, in addition, when people reach out to us requesting ramps, we also have families reaching out to us wanting to donate ramps. I recently had a family who wanted to donate a ramp, a stair glide, a wheelchair lift to get into the house. And we were able to put them in touch with families who needed those items. And they communicated directly together. They worked it out. The person receiving it had to figure out how to move those items and get them installed. And they were so grateful to get them because these items cost a lot of money. So just the cost of moving it and installing it compared to purchasing the whole item was a huge benefit for this family. And the family giving it was so happy to have it being used by another ALS family. So we definitely try to do that as much as we can when we're called to give those big item donations that we can't keep in the loan closet, to put families together with each other.
great, thank you. I always love hearing stories about when one region has spoken to somebody else who knew someone who was able to get something taken care of. It's that kind of, it's why we do what we do, making sure that people are getting what they need, and how can we best help you?
We had someone over the summer that had some items to donate, and I think there was like a little bit of a hold up with the loan closets and because of the pandemic and things like that. Anyway, through a few of us, we were able to connect these to families, and the donating family called me and said, not only did they take the wheelchair, they wiped me out. And she was so happy to be able to give all these items that she thought she was going to have to throw in the garbage because nobody could use them. And they were so happy. They ended up getting, a few pieces of equipment, some medical supplies, things that she really didn't expect they would want, but they took them, and they didn't have insurance to pay, that would pay for those items. So they were really happy. So that was a nice story. But it was funny how they wiped me out. I said, uh-oh, what does that mean? But it all worked out really nicely.
Absolutely. All right. So it's been 3 very informative days, and I know a lot of us were on a lot of sessions as well as our colleagues. So I was wondering and nobody knows what I'm going to ask them, by the way. We're just having a casual conversation here, so I'm throwing things out. But I was wondering what, if someone would want to share, or all of you share, something interesting or new that you learned this week. I know we've got a wealth of information at our fingertips, but we're constantly learning from those around us. I'll give you a second to think about it, and I'll kick it off. Last night on one of our sessions on clinical trials, I was excited to hear that there's cross collaboration happening and conversation taking place, and seeing what we can learn about how to fast track and move forward and speed up ALS research based off of what we learned on how to make the COVID vaccine. So I thought that was really exciting, really great information, and looking forward to seeing what comes out of that and seeing the community work together and share information and knowledge. Almost everybody just took their mics off mute at the same time, but I saw Michelle unmute first. So Michelle, would you like to begin?
Mine's an easy one because whenever research comes on, I have lots of coffee before it starts, and then halfway through, I need more coffee. So I have lots of notes, again, that I've written every single time. I take a lot of notes for research, and it does lose me sort of halfway through for the medical jargon, but it's such an important thing to stay aware of and abreast of. We always get the sort of information that we need from the ALS website, so I know exactly what's going on in sort of a easier format. But getting down to the nitty gritty when the doctors talk about it, I won't be surprised if I hear some people say they got a little lost. I did too. And that's when I put you in touch with one of our nurses or anything else to get more information.
Same.
I'll
All right,
just
Tracy,
jump
how
in.
about you?
Yeah, I'll just jump in next and say, I learned a lot. I always feel smarter after I hear from the doctors. But I learned a lot, surprisingly, from Dr. Schultz's presentation. He had a slide on a historic perspective on the center at Mount Sinai, and he went back a little bit to its beginnings when it started out as Beth Israel. And I learned, that he, having been at the chapter for about 7 years now, you learn and you hear things and you train, so you think you know everything about all the centers. But I had thought that he was the only director from the beginning, him and Dr. McGowan, co-directors. But I learned about a new director, the first director of the clinic. But along with that, I learned a lot about Dr. Lang and his clinical research design and all the things he's done in the past. I was very surprised to hear all the historic perspectives and background of the doctors that I did not know. So that was great.
Thank you. Anyone else want to jump in with something new? Chris?
Yeah, I mean, I don't know if I'll call it learning exactly, but today the advocacy presentation with I'm sorry, I don't know if are we allowed to say names?
Yeah, the sessions were recorded. You can share who was presenting.
With let me see, I don't want to get their names wrong.
We had Becky and Paul and
Jeremy and Paul and those guys.
And Nirmal.
Nirmal. I thought they were they really held my interest. I thought they spoke so eloquently, and I really learned from them. And it was really interesting how involved they are with advocating for it themselves, for other patients and families. And I thought they just spoke so beautifully.
Absolutely. I would very much echo that. That's a great call out to that fact that anyone can be an advocate. If you want to help make change for the ALS community, it's easy to do from home. Another thing we're able to do even when things aren't fully back to normal right now. So please check out our website. As soon as you go to als-ny.org, there's a little button right at the top that says advocate. You can click that. It'll show you how to sign up to be an advocate. And then you'll get emails telling you when there's calls to action, what our asks are, phone calls to make. If you're not comfortable on the phone, you can send emails to your representatives. And it's a great way to get involved from home and help to actually influence policy. And then come down to DC with us one year, maybe. And this year, the advocacy conference is going to be virtual as well. It's, I believe, June 9th through 11th. And it's definitely in that sort of date range. So if I don't have that exactly right, you'll definitely be getting emails from us as well about that. Okay, we are in our last 5 minutes. The only question that's come in recently has been some very kind words for all of us. So I'm definitely going to take the opportunity to read those to my colleagues who I know are not only in the room with me, but who are also watching us because we're supportive of each other to the very last minute on a Friday. So I do want to ask, thank everyone for being here and also remind everyone to keep an eye out for our mail, our email, our postcards, which has information on support groups that are coming up and whether those are open discussion or opportunities to learn from people just like you did over these past summits, the past few days. That's what we're here for, to really get information into your hands, into your minds, give you things that you can do and take action with and make sure that you're as informed as possible. So I'm going to read this, and then Tracy, I'll pass it over to you to close us out with a couple of last words. Okay. Just before I do that, I will say that June 6th to 8th is the advocacy conference. Tiffany jumped on that one for me very quickly. So we've got an update on that. And then the week after that, we will be contacting Congress. So thank you, Lori, for your very kind words. She says, this has been a fantastic summit. I completely enjoyed putting faces with names. You have a wonderful chapter team and clinic leaders. I could not agree more. Thank you for all you do. And then, thank you so much. And Tracy, I'm going to pass that over to you.
Great, thank you so much. So just a few closing words as we end this 3-day summit. First of all, I want to say thank you. Thank you for being with us and making time to view our sessions. I am very grateful for having had the opportunity to co-plan this event with our very own Jillian Saperstein, who's Director of Fundraising and Special Events. She's a phenom, so thank you. Along with the Summit Planning Committee. And Ben is on that committee, Sharice, Chris, and Sue Zimmerman. So thank you to all of them. In closing, I just want to say we at the Greater New York chapter feel privileged to have had so many doctors, nurses, speech language pathologists, OT, PhDs, national staff, elder care attorneys, and other experts join us. The list was so long, and we are so grateful. And as I said in my opening remarks, I'll just want to echo them as we close out. We are here for you and your loved ones. We know that ALS affects the entire family, your nuclear family, your extended family, your networks of support. So we hope that you got to know us a little bit better if you've attended this session. Please feel free to call us at the chapter office and we will help you navigate your journey with ALS. We are here to support you and we ask that you allow us to become a part of your extended support network. Thank you so much.
Bye, everybody. Thank you.
Bye. Thank you.